Welcome, and thank you for your interest in the Heid Assess, Treat, Evaluate, or ATE, Guide for Clinical Teaching and Learning. This tool was developed to meet a need for a streamlined, progressive approach to learning to think like a nurse at the point of care. Our team recognized the need for a tool that supported both clinical faculty and nursing students using a common language. Based upon years of clinical practice and teaching undergraduate nursing students in a variety of settings, this tool was designed to move from a focus on paperwork to an emphasis on patient care and collaboration in real time. This video will demonstrate how to use the tool in a clinical environment to create a more realistic experience for faculty and students. We will illustrate each level of the tool and demonstrate the teaching strategies embedded. In Level 1, Making Connections, we begin with gathering cues from the patient assessment and health records. Through conversation with the patient, we will learn about the reason for seeking healthcare services and begin to consider how various cues provide a holistic view. As the learner begins to cluster data, they begin to make connections and consider how data are related to each other in preparation for the peer-to-peer huddle. As you watch the scene unfold, notice how the peers interact and the discussion that follows.
Hello, my name's Allison. I'm the student nurse who's going to be helping you today. I'm just going to bring up your chart here. Can you confirm your name and date of birth for me?
Yeah, I'm Rebecca Smith, but I go by Becca, and I was born October 2nd, '02.
Okay, wonderful. What brought you in here today?
I've been having this really bad cough and a fever for a couple days. I've been really tired, but I figured that was normal. I haven't been sleeping well, I guess. I've been really nervous about the cough. And I just feel kind of weak and achy all over.
So hopefully to relieve a little bit of your anxiety, we did get your COVID test back. Your COVID test came back negative.
Yay.
So we're off to a good start. Can you tell me a little bit more about your cough?
It's kind of moist, but like a little comes up, but not a lot.
Okay. And your fever, have you been taking anything for the fever?
I've taken Tylenol for it.
Okay. When was the last time you took the Tylenol?
Last night.
Okay. Do you have any other past medical history I need to know about?
I have a history of asthma.
Okay, and do you currently take any medications for your asthma?
I have an albuterol inhaler. I took it twice yesterday and once this morning.
Okay, do you usually have to take your albuterol this frequently?
No, but because of the cough, I just was hoping that would fix it.
Okay, that's a reasonable thing to think. As we're going through this, I'm going to take a set of vital signs. Is that okay?
Yeah.
Okay. As we've been talking, I noticed that you've had a little bit of anxiety. Do you have someone around here who you can talk to?
Yeah, my roommate and I are pretty close. She actually brought me here today.
Oh, wonderful. I'm glad you have such an awesome roommate.
She's been avoiding me a little bit.
She doesn't want to get whatever you have.
She has tests coming up, so she can't get sick.
Yeah. Are you guys both students here? What's your major?
I'm actually a nursing student.
Oh, wonderful. So you've been through this before.
Yeah.
So I probably don't have to tell you. Can you please roll up your sleeve so I can get a blood pressure? Thank you. As we're doing this, do you have any allergies?
Oh, I'm allergic to bees.
Okay, you can relax your arm there. Just a little squeeze. So you have the fever, the cough, any shortness of breath?
Just a little bit, but nothing as bad as the cough.
So I'm going to go talk to your provider, get a little bit more information. Is there any questions you have before I head out here?
Nothing that I can think of. Thank you.
Okay, I'll be back soon.
To facilitate the peer-to-peer huddle, we recommend the Level 1 Making Connections supplemental document. Using prompts with the patient at the center, students dive into analysis of data gathered. Socratic questions are listed to help begin the conversation.
Hey, do you have a second to go over my Heid tool with me?
Sure.
Okay, so to give you a little bit of background, I have a 21-year-old female patient. She came in with signs and symptoms of something like an upper respiratory infection. Her roommate brought her into the clinic because she just hasn't been feeling great, and her main priority right now is just feeling better and getting back to her everyday life.
Right, okay.
So in terms of like cognitive, neuropsychosocial, she told me that she could hardly get out of bed in the morning. She's feeling really tired. She does have a history of anxiety, and right now she's ANO4.
Did she express being stressed out about anything lately?
She didn't say it specifically, but she is a nursing student, so
Okay.
as you can imagine,
Right.
she's a little stressed.
Okay.
One of my main focuses was oxygenation and respiratory status, especially with those upper respiratory signs and symptoms. So she did say that she has a history of asthma. She currently has an albuterol inhaler. She said she took it twice yesterday and once this morning.
And did that help her?
Yeah, she says it helps, but the relief doesn't last too long, and that's one of the reasons she came in.
Okay. And with her cough, was it productive?
Yeah.
Okay.
Her, in terms of her vital signs, her respiratory rate was 22. Her SpO2 was 94 on room air. I listened to her lungs and they sounded clear.
Okay.
Perfusion and cardiovascular, everything seemed pretty normal there. Her blood pressure was 110/70 with a heart rate of 102. I wasn't too worried about that because she did seem a little anxious, a little bit of white coat syndrome maybe.
Of course.
So that's kind of what I got. I was going to maybe try to make some connections.
Okay.
What I'm thinking right now is maybe the fever could be causing some of that general fatigue and body aches.
I agree with that. And maybe her anxiety and her stress could be causing her poor appetite.
Oh, good idea. Anything else you can think of? Any other questions you think that I should ask?
No, I think what you have is good.
Awesome. Thank you so much for your help. I appreciate it.
No problem.
As we move into Level 2, Clinical Prioritization Guide, we use the framework of assessment, treatment, and evaluation to help us identify and prioritize patient needs as we begin to plan care. Based upon our analysis of cues, data is grouped into identified client needs. Each need is then defined according to related assessment data, treatment interventions, and evaluation measures. Using common nursing priority setting frameworks, students will rank the top 3 client needs. Let's listen in as the student collaborates with the provider and outlines the patient's plan of care. Hi, Allison.
Hello.
We just got done seeing Becca, and it looks like she's going to need a cough suppressant. But I looked in the EHR and didn't see her medications. Do you happen to know what they are?
Yeah, I was just about to get those entered.
Okay.
She is on Buspar, Tylenol, and albuterol right now.
Oh, good. Okay. Well, I will put in the computer some Tesla pearls for her to go home with, and I'm also thinking that we need to do some counseling services.
Okay.
Would you be able to find that number for me?
Absolutely.
Oh, perfect. Thanks, Allison.
You're welcome.
After the student develops their plan, they will meet with the clinical instructor for just-in-time clinical teaching. Using Socratic questions, the clinical instructor explores the student's perspective of the top priorities in each ATE column and seeks the rationale. This time allows the student to consider different perspectives and opens the door to deeper conversation to enhance the plan of care, determine outcome goals, and take action. This iterative process asks the student to continually gather data and reevaluate the plan of care, modifying as appropriate to meet the client's needs. As we rejoin the scenario, notice how the student leads the conversation and is coached by the faculty.
Allie, do you have a second to go over my Heid tool with me?
Yeah, of course.
So I just finished up level 2, and I need a little bit of help with my prioritization.
Okay, sounds like we're ready to do the just in time.
Okay, so I am pretty sure that infection would be my number 1 priority. Just using like the non-urgent versus urgent framework.
Okay.
Infection can spread quickly. We don't want that to happen.
Okay. I I would agree. So tell me a little bit about your column here with your infection, about your assessment, your treatment, and evaluation.
Okay, so for my assessment, my patient's had a non-productive cough for the last 2 days. Her skin has been flushed. She's been using her inhaler more frequently than usual.
Okay.
And the most recent set of vital signs that I got was BP of 110/70, heart rate of 102, respiratory rate of 22, temp 99.1, and her SpO2 was 94% on room air.
Okay, and then let's talk about treatment a little bit. What are some of your nursing interventions that you would be doing? And then some of the things that the physician might order.
So in terms of the nursing interventions that I would help with is I'd encourage oral intake of fluids to help her stay hydrated. I would encourage incentive spirometry use to keep her lungs strong.
Okay.
And I would make sure that she was continuing to use her inhaler as it was prescribed.
Okay, great. And then what about as far as orders go?
If we learn that this is a bacteria, I could see maybe an order for an antibiotic.
I would think that'd be reasonable. What do you think the physician could order as far as lab work goes?
I could see an order for a CBC. We might want to see what her white blood cell count is to see if she has an infection.
I think that's great. Okay, and your evaluation?
So what I would hope to see in her as we progress is her temperature to return down to within normal limits and see her cough improve, because that's one of the main things she was complaining of.
Yeah, great. Okay, so looking over, I see you have 2 others that you don't have listed priorities. So I see you have fatigue. Let's talk a little bit about that one. I noticed in assessment you're missing temperature. What do you think? Do you think that would fit there?
Oh, yeah, I think that would make a lot of sense, especially seeing as one of my treatments is relating to the temperature with the Tylenol and the cold compress.
Great, I'm glad you're making that connection. Okay, and you have your other priority is health promotion. Between these 2, what do you think is the greater priority?
That's what I'm struggling with, because I don't see either one of them as urgent right now.
So I think when we're looking at this, the fatigue is probably going to be more impactful at this point, because the health promotion is something that we want to make sure that we cover with her. But, if she's not able to, care for herself well at the moment, I think this is a big priority.
Yeah, especially since she's also a nursing student. I know if I was trying to do this while I was tired, it would have a big impact on my life.
Yeah, I would agree. Okay, so, and then the other thing is has the patient's priority changed during this visit?
I think so. I know her main priority when she came in was relating to that cough, that potential infection. But now that we've kind of helped calm some of her fears about that, she's seeing more of the anxiety side of it. And that's one of the reasons why the provider put in a consult for seeing a psychiatrist.
Okay. All right. I think that sounds great. I think you've done great with your priorities and recognizing them for your patient.
Okay.
Good
Thank
job.
you for your help.
Yeah, of course.
The next step, transitional care, is intentionally the most unique, as it creates a view of the client, their environment, and how collaborative services facilitate outcome achievement within the larger healthcare system. This section provides the opportunity to individualize care and may require the student to gather additional information. For example, asking about the patient's home environment and resources may help the student understand how this encounter impacts the patient following discharge. Let's listen in as the clinical faculty facilitates a midday conference to consider transitional care needs.
Oh, hey. I'm glad we ran into you. This was a good opportunity. We need to talk about our level 3. We're going to do some discharge teaching.
Okay, so for level 3, the main priority I had for Becca was infection. Since she did come in with that upper respiratory infection, her main symptom was that cough. So I ran into the provider. She has a prescription for Tessalon pearls, and she also asked me to go over some discharge teaching. Would you guys mind if I practice that with you?
Sure. I think that's a great idea.
Okay, so it's kind of what I was thinking of saying. Hi, Becca. I talked to your provider, and we have some teaching for you before you head out. So the first thing I have is a follow-up for you with your primary care provider regarding your asthma. We also have a referral for you into counseling to give you someone to talk to and help with your anxiety. Do you have any questions right now?
I don't think so.
Okay, how does that sound?
I think that sounded good. Remember that we need to tell her she's got to follow up in 3 days with her primary care provider. We need to make sure we have that phone number too for the counselor.
Yeah, thank you for the reminder.
Yeah, of course.
And based on what we were talking about earlier, that sounded really good. Maybe also just add in to stay hydrated.
Oh, yeah, thank you.
Yeah. Okay, great. Let's go ahead and head in.
Okay. Hi, Becca.
Moving Beyond provides an additional opportunity for collaborative discussion with other members of the healthcare team and clinical faculty. In this example, let's listen in as peers are talking about the impact of this encounter on the work unit, healthcare system, and community.
I've noticed a lot of people coming through with upper respiratory infections recently. Have you seen that as well?
I have too. I wonder if we're gonna run out of supplies.
Ooh, that's a good question. I wonder if we can look at the public health records to see what our local infection rates are like.
Yeah, I definitely think we should look it up and maybe talk to Allie about it at post-conference.
Yeah, good idea.
Hey guys, it sounds like you're having some great conversation in here. Just wanted to remind you we're going to meet for post-conference in about an hour, so complete any tasks that you need to do and finish up your paperwork, and then meet me in conference room 1, okay? Thank you.
You're welcome. Have you thought about what you're going to share in post-conference?
I have no idea. What are you thinking about?
I was thinking about resilience for my level 4 of the Heid tool. My patient is also a student nurse. I know I'm already so stressed going through this program, I can't imagine doing it while sick as well.
Yeah, I think that's a good one to talk about with your patient.
Thanks.
In Level 4, Structured Reflection, students are guided to reflect on care provided as they evaluate the client's progress toward optimal outcomes. Clinical faculty have an opportunity to facilitate conferences at multiple points throughout the clinical day. Through evidence-based debriefing methods, the instructor guides the group reflection to explore their feelings about the day, analyze their actions, and summarize key takeaways for future nursing care. Students are encouraged to share their 2 structured reflections responses either in a group or journal entry. Let's listen in as the clinical faculty demonstrates the most crucial part of this clinical experience.
All right, sounds like everybody had a great day today. So let's talk about your guys' patients. So who would like to go first?
I can go first.
Okay, great.
So I had a 21-year-old female patient come in today. Her roommate brought her in for signs of an upper respiratory infection. So she had a little bit of a cough, some shortness of breath, a fever, some muscle aches, fatigue, kind of all of those things that you would expect with an infection. So because of this, one of my big focuses was infection. And one of the other things I noticed when I was talking to her is she just seemed really anxious about everything that was going on. She's also a nursing student, so she understands the way things work, what can go wrong. So I tried to use some therapeutic communication to just help her feel a little bit better and supported.
Okay, great. So it sounds like you did a good job recognizing the priorities for her with your level 2. So looking at the Heid tool on your level 4, which question do you think fit well with your patient?
I liked question B about supporting resilience.
Oh, we were talking about resilience earlier. What did you and your patient decide that helps her?
She mentioned that going on walks brings her a lot of peace, as does talking to her roommate and her mom. So we worked on incorporating that into her daily life.
Good.
Okay, great job, guys. All right, who would like to go next talking about their patient?
I can go.
Okay.
So today I had a 7-year-old male.
Clarifying expectations is essential for both clinical faculty and students to get the most out of each clinical encounter. The evaluation rubric is designed to outline the key considerations in each level of the guide. By creating objective elements of the clinical experience, the student is able to become more accountable for addressing the patient holistically, helping them identify if they are missing something so they can address the client's needs before the end of the clinical day. As the clinical faculty, the evaluation rubric illustrates contextual factors such as the environment and individual characteristics of the nurse, to better develop clinical judgment in each unique clinical situation. Most importantly, use of the rubric can support reliable, objective evaluation of clinical teaching and learning experiences. Periodically, assigning students to complete the evaluation allows students to identify their own individual characteristics and personal growth as they master the elements of the guide. Discussion with clinical faculty at midterm and final evaluation allows for a robust conversation and development of clinical judgment skills. Notice how the clinical faculty and student discuss the rubric together in this next scene.
right, well, thank you for coming into my office today. I appreciate we need to do your midterm evaluation. So I've got the rubric here to go over with you in relation to the Heid tool. So tell me about, you've started filling this out, where you think you are with each area.
So I was able to fill out step 1. I feel pretty confident about that. So one thing I felt like in my needs improvement category, my cognitive neuro assessment could use some work. I feel like I did a good job addressing the cognitive side of it, but I could do a little bit more to assess the neuro status. So I need to stop being so focused on certain things and have a more broad spectrum there.
Okay, so maybe those are some goals that you could set for yourself moving forward to focusing on those, so that you recognize that. So then moving on to the step 2 for your chart review. So what are some areas here that you feel like that you recognize with your Heid tool or in conversation?
One thing I think I did a pretty good job on was the med reconciliation. I was able to ask her what meds she was taking, and even though I didn't have time to get it into her record, I was able to verbally convey that to the provider. And I think that helped her figure out what she wanted to prescribe. So it felt really good being able to help with that process.
That's great. Yeah, so and I see you marked yourself satisfactory for that. So I would agree with that. What about, is there anything else here as far as, like, were there any provider notes or anything that you saw?
I didn't see any notes.
Okay, and that's okay. Sometimes in different settings we will have some things that are applicable and some things that aren't, depending on what area of nursing we're in.
Okay.
And then continuing through, going down to your peer-to-peer huddle, how do you feel like you're doing with that?
I think the peer-to-peer huddle was super helpful. It helped me really make connections, and she was able to give me some recommendations of other things to ask the patient that I might not have thought of yet.
Oh, great, great. So I'm glad to hear that you feel like that's really being beneficial for you. So it looks like for the most part you have several things here in satisfactory, just a couple things over here in needs improvement, and at this midterm I would expect that. I don't expect you to be satisfactory at this point, but I would like by a final for you to be in the satisfactory area. You've already identified some goals and some ways that you can improve. So, just continue to work on those goals and recognizing that we'll use this with evaluating not only the Heid tool, but, interactions and conversations you have in clinical as well. Okay?
Okay.
We hope this video helps you understand how to use the Heid ATE Guide for Clinical Teaching and Learning in your clinical experiences as a clinical faculty or student. More information about how to assist in the development of the tool can be found on our website and in the Google Classroom. You are welcome to contact any member of our research team using the Contact Us link on the website. Thanks for joining us, and we look forward to hearing how the Heid tool benefits you.